How to recognize breast cancer symptoms. Hello everyone, thank you so much for joining. May God bless you richly. Over the course of a woman's lifestyle, she may experience breast changes. While many end up being nothing to worry about, it is important to have any changes that you notice checked by a doctor, just to be on a safe side. Here are the potential breast cancer symptoms to watch out for. Please take note. This video does not replace actual medical advice. Always consult your doctor with any questions or concern. Here are the things that we are going to be discussing about. Monthly self-exam, have your lumps checked, looking for visible changes, looking for nipple changes, looking for swelling, also have regular checks, and always do mammogram if you are above 40. First is monthly self-exam. Start performing a monthly self-exam as soon as your breasts are fully developed. Checking yourself regularly is very important. Please check the description for the link of our previous video to understand how to do your monthly self-exam. Next is to have your lumps checked. Know what you're feeling for. A lump that feels different from your breast normal lumpiness, like discovering a pebble in your abdomen. Though many lumps are benign, meaning that they are non-cancerous, anything that feels new or odd should be checked by your doctor. Even if you've recently had a clean mammogram, please always check for lumps in your armpit as well. Next, beware of dimpled skin. Look for visible changes like dimpled, pockets, thickened, reddened, or scaly breast skin, or a flattened or indication on the breast. All are potential breast cancer symptoms that should be evaluated and checked. And if seen, this could help you discover early breast cancer symptoms. And of course, if discovered, you call for your doctor's attention such that this can be handled immediately and sorted out for you to be safe. Because once it is handled quickly, it helps save life and saves you from any potential risks of going under a difficult treatment. Next, nipple changes. Recognize the nipple changes that can indicate breast cancer. Pain, redness, scaliness, itching, skin thickening, the nipple turning inward, or discharge other than breast milk. All of these are important for you to identify early breast cancer symptoms. Next, have pain and swelling evaluated. See your doctor about swelling in all or part of your breast or breast pain. Though swelling and soreness are usually not cause of concern, these symptoms can be signs of a rare but aggressive form of the disease known as inflammatory breast cancer. So this is very important because it can help you also dictate inflammatory breast cancer. Next, get regular checkups. Have your doctor perform a breast examination at your early checkups and begin annual mammogram at age 40. If you have a family history of the disease, tell your doctor. They may suggest that you start having mammogram at earlier age. Thank you very much. It will interest you to know that in a breastcancer.org survey, 37% of the respondents detected their cancer with a self-exam. So what is the takeaway? Every lady should be doing this self-exam. Make sure you can do your self-exam so as to detect cancer early on in life. Thank you. Please don't forget to subscribe and share to your friends, share to your family. May God bless you. Have a wonderful time. Thank you very much.